أنا دكتورة سمر حسن شمر، طبيبة اختصاص علم الأمراض كيمياء مرضية. محاضرتنا اليوم عن thyroid gland and interpretation of thyroid function test للمرحلة الثانية كلية الطب. Thyroid gland is an endocrine gland that make two hormones, which called T3 and T4, and secrete them in the body. These hormones, T3, T4, are necessary for all the cells of the human body to work normally, like breathing, heart rate, nervous system, body weight, and temperature. So, the thyroid hormones have great importance, and its defect affect many functions of the body. About the anatomy of the thyroid gland bilobed occur in front of upper trachea. Parathyroid gland sit posteriorly, two on each side. The term goiters mean swelling of the neck, enlargement of the thyroid. About the hypothalamus pituitary thyroid axis, which control the release of the thyroid gland hormones. We have three glands, the hypothalamus glands, pituitary glands, and thyroid glands. The hypothalamus gland secretes thyroid-releasing hormone, which stimulate the release of the thyroid-stimulating hormone from the pituitary gland. The thyroid-stimulating hormone stimulate the release of the T3 and T4 from the thyroid gland, while the T3 and T4 from the thyroid gland have positive and negative feedback on the pituitary and hypothalamus gland. So, the tertiary disorder of the thyroid of the hypo or hyperthyroidism is the result from defect from the hypothalamus. The secondary disorder of the thyroid gland is result from the defect in the pituitary, while the primary disorder, hypo or hyperthyroidism, result from the defect in the thyroid gland. About the hormones T3 and T4, the difference between the T3 and T4 is the plasma concentration of the T4, total T4 60 to 150 nanomole per liter, while the free part of 9 to 26 picomole per liter, while the T3, the total range 1 to 2.9 nanomole per liter, the free part 3 to 9 picomole per liter. Relative potency of T4 mainly a pro-hormone, while the T3 nearly 3 to 4 times more potent. The half-time of T4 6 to 7 days, while the T3 1 to 2 days. The source of the T4 100% from the thyroid gland, while the T3 only 20% from the thyroid gland, while 80% from peripheral deiodination of T4. Largely in the liver, kidney, and muscles. Bindings protein. Thyroid hormones found in the circulation binding to proteins, and small concentration was unbinding, which called free thyroid hormone. The bindings proteins are thyroxine binding globin, thyroxine binding prealbumin, and albumin. Increasing in binding protein result in increasing of total thyroid hormone, but usually the free thyroid hormone adjusts. The causes of the increased binding protein is hyperestrogenemia, like pregnancy, estrogen, contraceptive pill, others drug, opiate, fibrate, nicotinic acid, congenital hyperthyroidglobulinemia, while decreasing protein result in decreasing total thyroid hormone, but usually free thyroid hormone adjusted. The causes are acute chronic illness, fasting, starvation, liver disease, kidney disease, drugs like androgen, corticosteroid, anticonvulsant, and congenital hypothyroidglobulinemia. The interpretation of laboratory thyroid function test. First, the indication of thyroid function tests are clinical suspension of thyroid disease, a newborn for early detection of neonatal hypothyroidism, elderly, drug exposure like amiodarone and lithium, history of neck irradiation, and autoimmune disease. Test of thyroid function. Laboratory tests of thyroid function are required to assist in the diagnosis and monitoring of thyroid disease. Most laboratories offer a standard profile of thyroid function test, which include thyroid stimulating hormone and free T4, and other additional tests are done only if these results are equivocal or the clinical circumstance require it. Why? The introduction of reliable laboratory assay for free T4 plasma total T4 concentration is almost always raised in hyperthyroidism, but may be normal in hypothyroidism, owing to secretion of T4 from the thyroid and increased peripheral formation from T4. Total T3 concentration, like those of total T4, are dependent on the concentration of binding protein in plasma, so defects in protein concentration affect their blood level. Thyroid stimulating hormone. Thyroid stimulating hormone remain the most commonly used endocrine test in clinical practice. Thyroid stimulating hormone stimulates cellular growth and vascularity of thyroid gland. The negative feedback control of thyroid stimulating hormone by thyroid hormone generate a linear relationship between thyroid stimulating hormone and thyroid hormone. So, the small change in thyroid hormone lead to much amplified thyroid stimulating hormone changes. So, thyroid stimulating hormone is usually the first thyroid function test to fall out of the reference interval. We consider thyroid stimulating hormone is the best initial screening test for thyroid disorder in most cases. A thyroid stimulating hormone value within the reference range exclude most cases of primary overt thyroid disease. The first disorder is primary thyroid disorder, defined by either decreased hypo or increased hyperthyroid hormone, with reciprocal and actually earlier and more evident change in thyroid stimulating hormone. Etiology of primary thyroid disorder. Primary hypothyroidism causes congenital iodine deficiency, autoimmunity, post-thyroiditis, post-thyroid ablation, while primary hyperthyroidism causes Graves' disease, toxic nodular goiter, iodine-induced ectopic thyroid hormone, excess thyroxine, factitious thyrotoxicosis. Autoantibodies in thyroid disease. Most thyroid disorders are autoimmune in nature. 3 autoantibodies are the most important, which are thyroid peroxidase antibody, thyroid reciprocal antibody, and thyroglobulin antibody. The thyroid function test result of various conditions which affect by feedback control effect of thyroid hormone on pituitary gland. These include primary hypothyroidism, where the free T4 low result in the TSH high. Thyrotoxicosis, where the free T4 high lead to suppressed TSH. Central hypothyroidism, where the free T4 low and TSH low, normal or high. TSH producing pituitary adenoma, where both free T4 and TSH are high. Calcitonin assay. Calcitonin, another hormone that used to detect and monitor the recurrence of medullary thyroid cancer. So the conclusion, TSH is a good screening test to assess thyroid function in an outpatient setting. If TSH is abnormal, the diagnosis is confirmed with the thyroid hormone level. Timing and choosing the right thyroid test is the best approach in understanding the meaning of the result. This case study for the student. Thank you.